November is Diabetes Awareness Month, a time to bring attention and awareness to this very serious chronic disease. Diabetes affects more than 1 in 10 Ohioans and millions worldwide. Today, I'm joined by Dr. Kambelos, Medical Director from Buckeye Health Plan, to discuss diabetes, including its rapid rise among Ohioans and ways to try to manage it. Dr. Kambelos, thank you so much for joining me today about this very important topic.
Always a pleasure to be with you.
So let's start talking about what is diabetes and why is Buckeye raising awareness about this condition?
Well, diabetes basically is a metabolism problem, and the end result is high blood sugar. And blood sugar, when it's high, particularly over a long period of time in a human being, in other words, uncontrolled diabetes, unfortunately increases the risk for so many very serious health problems. Diabetes is a common denominator illness that can lead to so many other health problems in life that are so very serious, and some of those could include an increased risk of stroke, increased risk of heart attack, certainly other vascular problems like gangrene, nerve damage or neuropathy, damage to the back of the eye or retinopathy, blindness, and kidney failure, all very serious health problems. And the reason we put such an emphasis on diabetes is because by helping people prevent, by reducing their risks, and helping them better manage their diabetes, we can improve not only the quality of their lives, but the quantity of their lives by helping reduce the chances that they'll develop one of these very serious illnesses with very long-lasting consequences.
Right, and I never thought about it like that diabetes is that common denominator. Kind of starts there. Well, let's talk more about diabetes and some of the diagnoses, because they're not all the same. Talk about the different types.
Sure, there are basically 3 types of diabetes, generally speaking. There's type 1, type 2, and gestational, and I'll touch on each one a little bit. Type 1 diabetes is typically seen in younger individuals, children. It's frequently abrupt in its onset, and we believe it to be primarily autoimmune in nature, where the body makes antibodies against parts of the pancreas, the cells that produce insulin. And those folks usually are diagnosed early on in life and are most commonly treated with some form of insulin.
And it's not a lifestyle necessarily.
Not so much in type 1.
Yeah.
Type 2, on the other hand, which used to be called adult onset diabetes early on in my career, is, in many cases lifestyle related, habit related, increased risk to become type 2 diabetic can come from being overweight, being sedentary, eating excessive amounts of carbohydrates. Those are the typical risk factors for type 2 diabetics. But unfortunately, what we're seeing is not just this being a disease of adults, but we're seeing this show up in kids at younger and younger ages. And that reflects back on the fact that our children nowadays are much more sedentary than there were in our generation when we were younger.
They're into the phone and the games and everything that has them sit down, right?
Exactly.
Yeah.
They're not outdoors playing until the street lights come on.
Right.
They're behind the computer screens and on their smartphones. And they're not as watchful of their diet.
Yeah.
So we're seeing a lot more of that. And then again, there's another one, and that's gestational diabetes. And that's where blood sugar tends to run high in a pregnant woman. Now that commonly will resolve after the baby is delivered, but the high blood sugar can affect mom and baby alike. That does confer an increased risk of developing type 2 diabetes later on in life, but it does not guarantee that the pregnant woman would become diabetic with subsequent pregnancies.
Now, are there more, or certain people at greater risk for diabetes?
Yes, and one would be the gestational type,
Okay.
Later on in life. And we more or less kind of touched on this, but, and this bears, importance. We should emphasize this. Folks who are inactive, folks who don't watch their diets, folks who are overweight, those folks are, and of course there's family history, which in many cases, most cases, all cases, we can't really change. But those are the risk factors for diabetes.
Let's talk about symptoms, Dr. Kambelos. What are some of those symptoms that we should be looking out for?
Early on in the diagnosis, the individual with diabetes may not have any symptoms, but when blood sugar readings are particularly high, some of the common symptoms that we see, could include frequent urination, excessive thirst, excessive hunger, unintended weight loss, numbness and tingling of the extremities. These are not all diagnostic of diabetes, but they can, be significant signs and symptoms that would indicate that as a diagnosis, and anyone with any of those symptoms should obviously see a physician promptly.
Let's talk about what we can do to manage diabetes. Once we get a diagnosis, what can we do to manage it?
So we've touched a little bit on the importance of, I'll get a little more specific, but diet and exercise and weight loss. So diet would be, reducing the starches in our diets, the breads, the potatoes, the pastas, the sweets, the rice.
Everything we can't tend to like, right?
Right,
Yeah.
I do too.
Yeah.
And the colas,
Yeah.
basically, simple carbohydrates, we should focus less on eating those and more on eating greens and vegetables.
Yeah.
Exercising on most days of the week for 20 to 40 minutes. That's obviously very important, and certainly weight loss.
All right, let's talk about what Buckeye is doing now to help people manage diabetes. I know you all have such a great program for a myriad of things, but what are you doing in the diabetes area?
We do, and I've said this many times in the past, and our motto at Buckeye Health Plan is that we are improving the health of the community one person at a time, and we sincerely care about our members, and it shows in the way we surround them with the resources and help they need to live a better quality lives. We provide them with care and case managers that can give them information on lifestyle tips, how to eat better, certainly how to exercise, where to access important health care services. We also will help our members get appointments with their doctors for their primary and specialty care. We'll also pay for the transportation to and from. And in addition, and this is important, our members earn what we call rewards dollars for getting their primary care services, vaccinations, and necessary diabetic care.
It sounds like you really do kind of hold their hand each step of the way. That's so important and valuable.
We do. We do the best we can to help our members.
Okay, Dr. Kambelos, thanks so much for joining us today and talking about this, educating us on diabetes. And for more information on diabetes tips, all you have to do is visit BuckeyeHealthPlan.com/diabetes.